Hi all, it's Dr. Nick back. Today in this video, what I'm going to talk about is the number one cause of disability worldwide, and that is low back pain. But we're going to be talking about specifically when you have back pain with running. So hop on in. So we're going to talk about some of the myths, some of what people think is the cause of low back pain and may not really be, how to fix it, what to do if you do experience low back pain, and what to rule out in the aka the super bad stuff, whereas you may need some additional help. And as always, don't forget to like, subscribe, share this video to someone who may need it. Like I mentioned before, low back pain, specifically chronic low back pain, which is back pain that lasts longer than your natural healing progression. Sometimes it's longer than 8 weeks, some say it's longer than 12, but any long-term pain, especially in that low back area, that lasts, again, longer than 8 weeks, longer than 12 weeks, it is the number one cause of disability worldwide. More than heart disease, more than stroke, more than every other comorbidity under the sun. Now, how does it become chronic? Well, that's the $64,000 question. Because what people think is the actual cause of low back pain and what actually is the cause of low back pain are kind of different things. If it were just due to your glutes aren't firing, you have a weak core, your pelvis is out of alignment, you have arthritis, we would all have back pain. And none of those are the actual real cause of chronic low back pain. Now, what is the cause? Well, it's going to depend on the person. There are lots of factors that are contributed to low back pain, which are, some of them may not be even structurally related, which means it has nothing to do with your x-ray or MRI or whatever. Some of the big causes are socioeconomic status, sleep habits, smoking, things like that. It's the things that we don't really consider contributing factors to musculoskeletal pain or pain in your body, in your joints and things like that. But those are the factors that we need to look at when it's determining these long-term pain development, specifically in the low back. One of my favorite studies that I love to show people is based on this. So they took people throughout the lifespan, from people in their 20s, every decade of life, from 20s up until their 90s. And these are people who have no back pain. And they took MRIs of all these people. And all of these individuals, from their 20s to their 90s, had some form of disc disease. They had some form of arthritis. They had some form of Facet syndrome. They had some form of spondylolisthesis, which is that shifting of one vertebrae on top of the other. Imagine that. People on all walks of life, they have all these things that people like to associate with back pain, but they didn't have any pain. Why is that? Because that arthritis, those disc bulges, those things like that, a lot of times they don't have anything to do with pain, especially in the chronic sense of it. Now, if you were lifting something super heavy that you weren't prepared for, and you feel a pop in your back, and then you go get an emergency x-ray, MRI, whatever, and it shows that stuff, maybe that's the cause of it. But since we're talking about pain that lasts longer than 8 weeks, that may pop out of the blue, we're not. So when we look at pain that, again, comes out of nowhere, lasts longer than 8-12 weeks, we need to take a deeper dive into the psychological aspects of what's going on in their lives. So like I mentioned before, what are their sleep habits? What is their social economic status? One thing that I always like to touch on are stress levels. More so than a pain scale. How stressed are you today? How stressed are you at home? How stressed are you at work? Things like that. When it comes to chronic pain, people want to have an answer. And sometimes I can't give them to them, and I have to tell them that listen, I don't have one specific answer for you, but we have to look at a lot of different things. So now say you have chronic low back pain, you want to get back to running, you want to get back to activity, you want to get back to lifting. Where do we start? Well, we start at what is your end goal. Like if you have low back pain, you've had it for 3 months and you want to get back to running a half marathon or running that Spartan Beast. That's your end goal. Great, that's awesome. That's a great goal to have. Put it on the calendar. Now, what can you do? Basically, we need to find your baseline. So where are you at right now in this point? Some people who have trouble standing still. Some people have, even some trouble walking. That's okay. We need to find out what can you do now, what's our end goal. When we have those 2 points, we fill everything else in the middle. Since this video is talking about returning to running, that's what we'll focus on. Now, this is going to look completely different for everybody. If your spine is super irritable with even basic movements, the first thing we have to do with you is get that spine comfortable with movement, which may just be, really basic stretches, mobility things like some things like yoga for like cat-cow, down dog, getting your spine used to bending and twisting and doing these things again that it may not appreciate right at this moment. Because running involves a lot of impact. Now, there may not be a ton of spine movement in running as well, but when we think arm swing, we have to think a lot about rotation and those forces like that. Another thing we have to think about is impact. So being able to handle the repetitive stress that goes along with running. And not only can the spine take the forces, but can the muscles take the forces? Can the joints take the forces? Things like that. Once we can get the spine moving again, we want to introduce some of that impact. If that's walking, that's great, but walking's a great place to start. We can also do something like a pogo hop, where we get that repetitive stress going in that plane of motion to get used to that impact again. And once again, there's no real set criteria as I want to, whereas I need to do this first before I get back to running. But if you can't handle the stress of running, some of these things might be helpful to do first. But if you feel ready that you can, what I like to show patients who haven't ran in a while is a running program. And the University of Delaware Physical Therapy program created this really great running program that I've used with clients to get them back into running, and I'll drop it in the comments below. Now, there's 8 levels to this program. The first one is you start out at a walk to a jog in a 1-to-1 ratio. You repeat that 8, 9, 10 times. The next level up has you jog a little bit more than you're walking, but you repeat that the same number of times. And then you expand on that, where the duration goes longer and longer until you get up to 2 or 3 miles. The final level is when you alternate actual running versus jogging. Now, what is the speed difference there? Something's a little bit faster. But they also give you some ground rules which can be great to follow to prevent you from doing too much too quickly. Some of these rules include taking mandatory rest days for the first 2 weeks of the program, and also not progressing more than 2 levels in 1 week. Yes, that means it's going to be really boring early on, but again, that's going to ensure that you don't do too much too quickly. Another big thing when it comes to return to running is making sure that you're supplementing your running with some sort of strength training. And that's going to include just your full body here, with emphasis on your glutes, glute med, hamstrings, quads, calves, core, which is something you should be doing anyway. So in conclusion, when it comes to returning to running after you experiencing some chronic low back pain, think about the factors that are involved. It's much more than something structural that your glutes aren't firing. You need to take a look at stress levels. You need to take a look at work. You need to take a look at status like that. You need to be able to sleep. You need to look at your nutrition. It is a full body experience that you need when it comes to chronic low back pain. And there's never really one root cause. And when it comes to returning to running, you find your starting spot, you find your end goal, and you start slow. If this isn't the most helpful video ever, that's fine. Pain is very complex. Pain is very tricky. Pain is different for every single person, and every single person is going to respond a little bit differently. If you're struggling with your chronic low back pain and want to return to running, You can fill out the form that's in the description and set up a discovery call. I'm also, again, posting the return to running protocol in the description as well. So you have that to look forward to also. Thanks for watching. Good luck in your recovery.